HIPAA and state-specific regulations. Learning objectives. By the end of this section, participants will be able to understand HIPAA requirements as they apply to small out-of-hospital midwifery practices, identify state-specific regulations affecting midwives, billing, and patient records, implement compliant workflows for protecting patient privacy and handling health information, develop policies and staff training manuals to maintain legal and ethical compliance. Why regulatory compliance matters. Regulatory compliance in midwifery and healthcare matters because it supports comprehensive framework that protects patient information, minimizes legal and financial risk, fosters trust, and optimizes operational efficiency. You want to be able to ensure sensitive health data is secure against unauthorized access, breaches, and misuse, implement administration, physical, and technical safeguards to uphold patient privacy, comply with laws such as HIPAA to maintain confidentiality and data integrity. The prevention of costly fines, legal exposure, and reputational damage. You want to be able to, for you as a billing company and the midwifery practice, avoid penalties associated with data breaches, improper billing, and noncompliance. You want to reduce the risk of lawsuits and regulatory investigations that can disrupt your service and potential profit line. Protect the organization's reputation from demonstrating those commitments to legal and ethical standards. You want to be able to build patient confidence knowing their health information is handled responsibility, enhance patient-provider relationships leading to better satisfaction and loyalty programs. Transparent communication allows the midwifery practice and the billing company to have strong accountability within the delivery system of health. You want to reduce audit risk through accuracy, compliant documentation, and billing practices, facilitate efficient workflows that standardize your policies, training, and reporting systems, enables continuous quality improvements by identifying and addressing compliance gaps that the billing company and the midwifery practice have in serving the patient. There's additional benefits. You want to be able to enhance the safety to the patients by adhering to these standards, building staff confidence and professionalism, improve the opportunities for eligibility for certifications and accreditations, specifically with HIPAA and patient privacy compliance. You want to be proactive with risk management, not reactive when it comes to insurance, fraud potential, HIPAA violations, billing, risk management. So just as an overview, HIPAA sets national standards for protecting patient information, ensuring privacy, security, and accountability across all spectrums of healthcare. It governs how patient information is used, disclosed, and safeguarded to prevent breaches and maintain that. So the whole point of the privacy rules is to protect all forms of patient information, electronic, paper, and oral, limits access to patient information strictly authorized to only the personnel that's supposed to see it, sets national standards for how patient information is used, disclosed, and protected among covered entities and their business associates, grants patient right access to their own medical records, request amendments and obtaining on all accounts of disclosures, permits disclosures of patient health information only as allowed by the rules or the patient's authorization, balancing privacy when necessary with healthcare coordination. So as a security rule, it requires covered entities to implement administrative, physical, and technical safeguards to protect the health information. Administration safeguards include risk assessments, workforce training, and security management. You're going to want to have physical safeguards in place with device security, facility access, and workspace use policies. There's going to be technical safeguards. You're going to have unique IDs, passwords, encryptions, and auditing trails of who has accessed the systems. How are you going to store it? How is it going to be accessed? And who has access to certain. Breach notification rule. This is a mandate by covered entities are required to notify affected individuals, the Department of Health and Human Services, and sometimes the media when a breach occurs. Notification must be done without unreasonable delay and within specific timeframes, usually within a couple months of discovering the breach. It requires detailed documentation of the breach investigation and how you are reducing the risk of exposure, promotes transparency and accountability in responding to data breach. Patient rights under the HIPAA, they have access to their own medical records in a timely fashion. There is the right to correct and amend health information that's inaccurate, right to receive notice of explaining how their health information will be used and what are their privacy rights. They have the right to restrict who has access to insurance information and like with power of attorney, guardians, permission to disclose medical information to billing companies and to insurance companies when processing claims. They have the right to accountability of disclosure of who had access and who received their information and being able to have confidential, protected communication platforms being utilized by the billing and practice. On top of national standards, there are state-specific regulations based on midwifery scope, practice, and billing compliance standards. They are going to affect details your day-to-day operation and your reimbursement expectations in regard to protecting that. So you want to really understand the state regulations, the scope of practice, the legal obligations every midwife has in the state they're serving. The electronic paper record retention timelines vary based on each state. Mandatory requirements for reporting are vary. Telehealth regulatory consents, and just the prescribing and permission for cross-state practice standards vary by state. Guidance from midwifery boards and health departments on how to handle privacy protection. Billing alignments of your policies need to match the state documentation rules. So you have to be very familiar with who you serve and how you serve them. You want to implement HIPAA compliant workflows. You want to implement things that work on a national level and on local state levels, depending on who you're going to serve and how you're going to serve them. So step one, you want to have access controls. You want to have data encrypted systems that your patients have access to, the midwives and the billing company. You want to monitor who has access and if there's any suspicious activity. You want to have secure communication at all times with encrypted emails, digital communication regarding the billing claim processing. You want to avoid unsecured apps and platforms that could potentially breach data, secure client-patient portals within a lot of the billing clearinghouses and the charting systems, data storage, backup systems, HIPAA compliant charting systems, cloud-based storage systems. Your physical records are in secured filing systems that only limited people have access to. You perform regular secure backups and test restoration processes. There's certain timelines that you have to keep the records for. HIPAA has a minimum of 6 years, but some states have longer. You want to have all aspects of the records, the billing, the consents, the intake forms, the documentation notes. You need to keep the records updated and accurate throughout the care and billing process. It's essential that you train all your staff with the midwife practice and the billing practice about HIPAA and specific state laws that are in place depending on who you serve and how you serve them. You need to give records of the staff's trainings and attendance, whether it's a competency, a quiz, just attending a training certification to show that your team is up to the current standards when it comes to protecting patient privacy. When you're billing and doing patient health information compliance, the midwifery practice and the billing company have to follow strict HIPAA compliance guidelines on a national and state level. There's core practices in limiting that risk exposure, secure networks, and not giving access to unauthorized personnel and only giving access to the things needed. So the billing company needs to have access to the documents that have to do with the billing claim submission process. So if there is a defense that they are audited and they need to provide proof, you got to be able to only include necessary things on the claims that are being requested, the minimum necessary standards, Avoid sending additional documentation that doesn't have to do with that specific claim. Using secure electronic claim submission systems, being able to have secure encryptions and security transmission systems utilized for all transfers of patient health information. Maintain compliance with sending explanation of benefits and encrypted systems. Implement workflows for reconciling billing data securely, your dashboards, your HIPAA medical information, so your invoices, your charges, your communication, all have to be encrypted and protected. You have to distinguish between having internal and external billing compliance standards. So the communication of the midwifery practice is going to be a little different than the communication between the billing company and the midwifery practice when it comes to protecting the privacy of the patients. You need to have ongoing trainings and risk assessments performed within the billing company and the midwifery practices so that this does not become an issue later. Common pitfalls and challenges that come with HIPAA and things to easily fix problems. Accurate and complete data, making sure you get the pre-authorizations that need to be done in order to get the claims processed. Improper use of billing codes and modifiers, duplicating billing and untimely billing, insufficient HIPAA training awareness, weak access controls, data security breach, failure to document policies and compliant efforts, over-reliance on a third-party vendor without proper oversight and proper understanding of their HIPAA compliance, no business associate agreements in place, no regular audits of the vendor. Tools and systems, you want to make sure your billing company's clearinghouse, the charting system, the message communication, your dashboards, anything that could potentially have that patient medical information is a HIPAA compliant platform you're being used. So there's a lot of great charting systems out there for midwives. And then you just need to make sure there's long-term encrypted storage systems, easy to access audit trails, protection for that bill integration, secure communication tools, training platforms, audit monitoring tools, and you want to make sure that everything with HIPAA compliant protects the patient's information, whether it's electronic, paper, or verbal format under the national and state laws. There's minimum necessary standards you need to have in place to protect you, but you also need to make sure the midwife practice has that because it's going to affect your reputation and your potential profit margins just as much as the midwife practice.